We just wanted to take some time to thank everybody for joining us for ALD's Career Conversations. It's a new series that we've offered this year. Last year, we updated our tagline to taking you from first year to career, and this series looks to really help do that. So we're grateful for our successful alumni like Lexi, who've kind of come back and they're going to talk about their pathway. We're also thrilled to have our ALD members here, not only to listen to her journey, but to also ask some questions at the end. So during the main conversation, if you could keep your microphones and videos on mute, that would be great. And then at the end, if you want to turn them back on or if you want to use the chat, we're happy to field some questions. So wanted to start by introducing the facilitators and our featured guest. So facilitating today will be myself and Eileen. Eileen, you want to introduce yourself?
Sure. Hi, everyone. My name is Eileen Merberg, and I'm the Executive Director of Alpha Lambda Delta. We're in the national office here in upstate Western New York, a suburb of Rochester, New York. Welcome.
And I'm Trish Maxwell. I'm the Director of Communication for Alpha Lambda Delta. I work in the national office with Eileen and primarily supporting our members and our chapters. Today's guest speaker is Lexi. She was inducted into ALD in 2013 at the University of Cincinnati. She majored in communication sciences and disorders. Is that correct, Lexi? Okay. And she earned her master's in speech language pathology, also from the University of Cincinnati. She is a speech language pathologist at the University of Cincinnati Medical Center. So she's here to answer some of our questions today. So just to kind of break the ice a little bit, we thought we'd do a few fun questions. So Lexi, if you could only eat one meal for the rest of your life, what would it be?
I think of all the questions you sent me, this was the hardest one to answer. Like, oh my goodness. It would be Italian for sure. Lasagna, something like that, with some gelato or some ice cream at the end.
Ooh, gelato. Nice. Perfect. Can't go wrong. Okay. If you won an all expenses paid 7-day vacation and COVID restrictions were magically gone, where would you go?
I would absolutely go either to Portugal or Greece. I'm actually getting married next year, so I'm fingers crossed that COVID is not going to be a thing next year.
Congratulations.
Or at least it's going to be a little bit better contained, and we'll be able to go to Portugal or go to Greece and just sit on the beach. I don't know. We'll see.
Great.
That sounds amazing. So what did you want to be when you were younger?
I always thought I was going to be a doctor. I was playing doctor or playing nurse, all of that kind of stuff when I was little. Always was interested in the medical field. But then as I got older, I kind of was like, I don't know if the schedule of a doctor is for me. So that's why I kind of feel like my career is a good compromise, because I still work a 40-hour work week, but I am very heavily medical. So it all worked out.
During that, we are going to jump into some questions related to your major, your undergrad experience, and in particular about Alpha Lambda Delta, because that's what we're here, that's our common thread. And so what role did Alpha Lambda Delta play when you were an undergrad in Cincinnati? Like, were you involved? Did you join just for the recognition, or did it give you skills? Could you say a little bit more about that?
Yeah, I remember, I sat with these questions and I was like, oh my gosh, this makes me feel like college was so long ago, but it really wasn't. I remember as a freshman, we would get emails and letters in the mail all the time about different honor societies to join, right? And it was kind of overwhelming knowing what was real, what wasn't, what was going to be worth it. And really, Alpha Lambda Delta was the one that I ended up joining, and I loved it. I was heavily involved for my 3 years of undergrad. So I joined my first year, started going to meetings and meeting new people. And my second year, I ended up being on the executive board. So I was the recruitment chair for our branch, I guess, at UC, and started growing our chapter. And then I actually became the co-president during my senior year of college. So I got to go to the Alpha Lambda Delta convention, the national convention, which was really a great experience. I met so many new people. And I just really felt like when I left, I made an impact at UC, which was a really cool experience for me. Just having the opportunity to network, to grow, to meet new people, just to learn how to be a leader and manage people. I mean, I loved my experience with ALD. I can't say enough positive things about it.
Great, thanks. We might use a clip of that the recording just now in our promotional material.
I know, and I'm kind of like, oh shoot, I forgot about that it was recording. I live in Scrubs, so
there you go. It's perfect.
if I'm not in Scrubs at work, I'm in comfy clothes, so at least I have my Bearcat stuff on.
There you go.
So when you think about your major, Lexi, and the academic experiences that you had, how did it help prepare you for your career?
My major, they were all about looking at extracurricular activities on our resumes, because for my degree, to be a speech pathologist, you do have to go to graduate school. So if you guys are considering that career path, you do have to apply to a 2-year program. So it's typically 3 semesters. So you'll go fall, spring, summer for most programs. And it is highly competitive. So anything that you can add to your resume is beneficial, whether it's leadership or volunteerism.
Right. And just to kind of tease this out a little more, Lexi, so I know your undergrad was in communication disorders and sciences, right? Or sciences and disorders. The last institution that I worked at, the undergrad was in speech language pathology. Does that matter? Is it the same thing? Is it a little different?
No, actually, communication sciences and disorders is the undergraduate program that prepares you to either be an audiologist or a speech language pathologist. So if you take all of the prereqs for a CSD undergrad, you could then choose to be an audiologist or a speech pathologist. So I didn't even know that they had an undergrad in speech pathology in some programs. That's really interesting. Mm-hmm. It's kind of a mouthful to say, oh, my major was in communication sciences and disorders. And people are usually like, what's that? But they do recognize speech language pathology most of the time.
Nice. Thank you.
So you talked about the importance of the Alpha Lambda Delta involvement, which is great, that really directly benefited you when you applied to these competitive speech language programs, the 2-year programs. But can you talk more about your academic undergraduate experience, again, and through the lens of maybe what our participants today might learn from, specific to your career, about like internships? Did you do research with any faculty members?
Yeah.
Are there internships available for undergrads who want to go into the field? What's that like?
As far as I know, most programs require you to shadow for a certain number of hours for being a communication sciences and disorders undergraduate. So you'll need to reach out to different schools or different hospitals or different medical settings to shadow and observe and kind of see what setting is interesting to you. Same thing for audiology. So I remember I shadowed at a school. I shadowed at an outpatient clinic. I also think I shadowed an audiologist just to get some hours and really so that you learn what's interesting to you. And it also is really helpful for just building those relationships with professors, with just people out in the field. Communication sciences and disorders in general, it's a relatively small field. So especially here in Cincinnati, the networking is really, really important when you get out of school. In terms of, there was another part of that question that I wanted to highlight on. Oh, research. When you're an undergrad, I think I remember being intimidated by graduate students, but being intimidated about all of these opportunities and not knowing how to ask. And I do think that it is worth putting yourself out there and seeing if you can be on a project. So if I hadn't gotten involved in research when I was in undergrad, I don't know where I would have ended up career-wise. getting that opportunity and reaching out to actually my another person that I knew who was a junior or a senior, an upperclassman, and asked about a research opportunity. I ended up learning that I wanted to work with adults, that I wanted to work in the medical setting. So I did research on people with aphasia, which is a language disorder that occurs after a stroke. So I had thought that I wanted to work with kids with disabilities, which is a lot of what speech pathologists do in the schools or in an outpatient setting, and it's absolutely wonderful. But there's this whole other medical side of what we do, and my eyes were kind of opened during my second year of undergrad, whereas a lot of the time, I think if you're thinking about being a speech pathologist, you only think about the school setting and you're not thinking about all of the other opportunities and settings that you might have available to you. So if you guys are at all considering this as a career, definitely reach out to your professors, reach out to even people in ALD. I remember Lauren Bosselet was the, I don't know what you guys call that.
She was the chapter advisor.
She was the chapter advisor, yes. And I had a great relationship with her, and she was so wonderful about, oh, I know this person, or, oh, I know this person. Let me reach out and see if there's any opportunities there. So take advantage of those people because they are there to help you.
Wow, that was great. That's great advice. I think you sort of covered it all, but sort of the gist of the question too was we sort of bill ourselves as helping when students join. ALD takes you from first year to career. Mm-hmm. So describing your path and your experiences along the way that helped is great. Is there any, I mentioned research and internships, are any other pieces of your path that you'd mention that you think is worth mentioning?
Yeah. Another way that Alpha Lambda Delta really helped me and helped me get my foot in the door with graduate programs was because I had such heavy involvement in this organization. I ended up asking for letters of recommendation from Lauren, and I ended up actually getting scholarships from Alpha Lambda Delta, which was so helpful for paying for graduate school. And it just really was something that I really valued, and it's just really cool to give back and get to do this today. So just there are so many opportunities out there through this organization, so don't be afraid to ask.
Thanks.
So speaking of graduate school, do you have to, when you're going into a speech language pathology program, do you have to kind of know what area you want to specialize in? Is there opportunity to kind of figure it out?
That's a really great question. And the good thing is the more open-minded you are when you go in, the better. Because you're going to get training in all areas of speech pathology. So we had classes on early childhood development and language development. We had classes on voice disorders. So there are some speech pathologists in the field who train singers who have voice disorders, like, Adele, and so there's so many famous singers that have had voice disorders. So there's just so many cool opportunities for us in our career paths. But you have training in everything. And another thing that we do is the first year is heavily coursework, and you do have some placements, some graduate student placements, but then your second year, you're really, I say you're paying to work. So you're paying your graduate tuition, and then you go and work in the schools or work in a hospital setting for free while you're receiving that training from a supervisor. So
this kind of feeds right into where you left off. Can you talk a little bit about what graduate school is like? So I know, the first part was pretty course intensive and the second part was more hands-on, but like what type of courses did you experience? And, were there a lot of room for electives or not really? And stuff like that.
At least from in graduate or in undergrad, you get to take so many electives, and in graduate school, that's not really the case. It's all very, very structured. And the cool thing about it, though, is that I got to be in a class of about 40 people. And so you're all going through the thick of it together, which is awesome. You have the same schedule every week, especially in that first year. So you make really good friends, and there's lots of group projects, and you're all sitting on campus all day long in grad school. So it's very structured. And then in the second year, it's more so, I think overall I got to take 3 electives. So I chose more medical courses. Like I did one on head and neck cancer. But then other people do like pediatric swallowing disorders if they want to work with kids. So it really though is very structured. You're doing the same thing with this program. You're taking the same exact classes as everybody else with that degree. And then second year, you're working 40 hours a week typically. And then in the evenings, you have classes 2 nights a week. So your first year, you typically have classes probably 3 days a week, all day long. And then on the other 2 days, you might go to a part-time placement for a couple hours. And then that second year is 40 hours a week plus night classes. So it is intensive. I worked part-time during my first year of graduate school just to have a little bit extra money. Second year, it was pretty much impossible to work because you're doing your placements full time.
Yeah, that makes sense. So you finished grad school, life is good, right? I'm interested to know, like, what does a typical day at work look like for you? And I'm interested to know what it looked like kind of before COVID and now during COVID, and if there's been any
my
impact.
Gosh, so much impact. So just to give you guys a breakdown, of my closest friends from graduate school, we all work in different settings. So I have one that works in an inpatient children's psych hospital, and she does speech therapy there. I have 2 friends that work in the schools, middle school and early childhood. I have another friend who works in a nursing home. And then I work in an acute care hospital. So that just goes to show you that's just 5 girls. There's such a wide range of workplaces for you, which is really, really awesome. And it's something where I could work in a hospital for 10 years, say, oh, you know what? Now I'm ready to start my family. I want to go and work in the schools and I want to work part-time. You have that flexibility as a speech pathologist, which is really cool and I think really rare. So that's just something to consider if this is a field that you're interested in. Something that I love about it is that I might get bored and jump and do something different, and that's fine. But my day. So my day is different every single day. And that's what I love about being an acute care speech pathologist. So I come into the hospital and pull up our medical record system, see how many patients are on our caseload for that day. And we divvy up like new evaluations. And then I might go and see patients with an acute stroke who I'm doing a swallowing evaluation with and a language assessment. So when I say swallowing assessment, people are usually like, what are you talking about? Speech pathologist, what do you mean? But a lot of what we do is assessing oropharyngeal swallow. So are people at risk for aspirating or having food and liquids go down into their lungs? If they are, what can we do to prevent that? So we do a lot of strength-based training, and we do 2 different types of evaluations to assess swallowing function. So we do x-rays of people's swallows, and I also am an endoscopist. So I take a tiny camera, like a long tube. If any of you have ever been COVID tested and you have that thing shoved up your nose and it's really painful, yeah, I kind of do that to patients sometimes. So I take a camera, I run it through their nose and watch them swallow and see if they're aspirating. So it's really cool, and it's not painful, or at least most of the time it's not painful if I'm not bumping into anything I shouldn't in the nose. But anyway, that's just something cool about what we do in acute care, and not a lot of other settings assess swallowing with that tool. So a lot of what I do is swallowing related. And then after that, I might go see somebody in our emergency department for a cognitive evaluation after they've been in a car accident. And then maybe after that, I'll go up to our second floor and go to our ENT unit and do an evaluation for a patient with head and neck cancer. So every day is different. It's very challenging. It's very rewarding. I meet so many new people. But because I'm not in a school setting, or because I'm not in an outpatient setting, I don't see the same patients over and over and over for treatment. I don't really know what happens to my patients after they leave the hospital. They typically go to a rehab center, or they go and get outpatient therapy, and they build those relationships with therapists in those settings. In my setting, it's more critical. So That was very long-winded, but
Yeah,
I'm very
no,
passionate about what I do.
you are, which is a great segue to what is your favorite thing about your career? You sort of touched on some key things about seeing different people and yeah, but do you have a favorite thing?
My favorite thing to do is with patients who have a trach. So they have this tube that comes out of their neck. And this is typically for patients who've had respiratory failure for some reason or another. With COVID, we've had a lot of patients who can't have that breathing tube from their nose or from their throat taken out. They can't get off a ventilator. They can't have that in their mouth for too long because of damage to the trachea. So they put in a tracheostomy. And what I do is I put a speaking valve on the end of that tracheostomy eventually so that the patient can finally speak again. And my favorite part about my job is seeing a patient get to talk again after weeks of not being able to, and just being able to restore that communication ability. It's really, really rewarding and cool. Also, COVID has changed everything about working in the hospital. I mean, it's so nice to be home on Thursdays because I don't have to have a mask on my face and a shield and gloves and gown and an N95 when I'm seeing COVID patients. Yeah, it's stressful, but now it's just a new normal for us.
Right. Yeah. Good. I see the passion and excitement. That's great to see. I love it. So we've got a bunch of students, ALD members here. We've got, I'm sure many who will watch the recording. What advice do you have for students pursuing a career in this field?
Grad school and applying to grad school was probably one of the most stressful times of my life. Take a deep breath. You will get through it. Rely on those people that are your close professors, your mentors. Rely on those people to write you good letters and to talk you through the process. It does get easier, and it's not the end of the world if you don't get in your first year. It is very competitive, and you have to build your resume with other things. It's not all about the GPA for speech pathology school. But people, I mean, it was very stressful. Just, you will get in. If it doesn't happen your first year, there are opportunities for you. So just keep building your resume during that year off and reapply. Don't give up on it. Yeah, I guess that's it.
Great. Thanks.
I'd like to ask a question.
Yes.
Yeah, go ahead.
So I'm a sophomore at the University of North Carolina, Greensboro, pursuing speech pathology. I guess I'm pretty far from, going to grad school, and I haven't even been able to apply into the major yet. I won't be able to do that until next semester anyway. But I feel as though with COVID, it's kind of hard, trying to get some shadowing or talk to someone, get with someone to, give you more insight, get more, viewing hours and stuff like that. So what do you think is a good suggestion for people who, are just starting out, haven't really had the opportunity to go out, speak with a lot of speech pathologists, look and see what they really want to do? How should we go about that?
Do you mean as far as what you want to do in terms of the actual career itself, or the work setting you might be interested in?
A little bit of both. I haven't been able to really see exactly what I want to do within the field because, now it's COVID. I don't really have anybody to talk to, anyone to go to and stuff like that. So what do you suggest you should do to get more involved and things like that?
Yeah, that's really, really hard.
Yeah.
It's a good question.
So here's maybe a follow-up question. Is there a professional organization she could get a part of, be a part of? Is there a good way to find a mentor, whether it's a formal or informal approach? I think those are ways that you could go about doing those type of things.
Yeah, because I remember a lot of what I did was just looked up schools around me and reached out to them and would see if I could come and shadow. Obviously, that may not be possible right now. Right. A lot of people are doing telehealth, so you could reach out and see if you could shadow that way. and at least be present in the room with the therapist with the laptop and see what's going on. A lot of healthcare is shifting to telehealth too. So that would be really cool for you to see. But as far as an organization, that's a really good point. If you haven't, I know UC requires undergrads to join NISLA. You should
I'm a part of that.
Yeah,
I just
you should
joined
join
that
NISLA.
this semester.
And NISLA has a lot of great resources on the ASHA website for reaching out for student leadership development programs. Same with, you should join, when I was in school, I joined OSLA. I joined the student membership for the Ohio Speech Language Hearing Association. I don't know if North Carolina has one, but that would be something where you could reach out, and there are obviously speech pathologists all across the state then who are members, and you could reach out there and see if there are any opportunities. I know that now that I am a supervisor for students, I love when people email me or find my name and reach out and say, hey, I'm really interested. Can I come and observe you? Obviously, right now we're not doing that, but it's good to show that initiative for sure.
Okay, thank you.
I'm trying to look it up real quick. What are the letters you're saying?
Yeah, it's NSSLHA. So NISLA is the national one. And then each state should also have a speech language hearing association. And typically they do have a discounted student membership rate that you guys can join and network that way.
Great. Yep.
Awesome. Eileen's putting those links in the chat if you don't have them. Jessica asked a question in the chat. If I work in a school setting, would I have to diagnose throat disorders?
No, good question. No, typically you would, if you're suspecting a swallowing disorder or anything like that, or a voice disorder, you would refer to pediatrician, ENT, a medical doctor to make those diagnoses. And a lot of the time, if you have those children who are medically complex, they probably have a history with a children's hospital, and you will know what their diagnosis is already as a school speech pathologist. But really good question.
Mm-hmm. Great. One more question in the chat from Caroline. What has been your biggest challenge on your path to becoming a speech pathologist and while in the profession? And then how did you overcome the challenge?
Oh, very good questions. I think a lot of the challenge for me, I'm going to pull up the chat so that I can make sure that I answer both parts of this.
Mm-hmm.
The biggest challenge on my path to becoming a speech pathologist was definitely the interviews for my graduate student placements. This kind of thing makes me nervous. Talking to new people and going through an interview process makes me nervous. I had to practice, and I had to practice. Like I would have my mom or my roommate sit down and ask me questions, and they were like, no, you have to pretend that you don't know me. And we took it really seriously, and I feel like that really helped. You will have to do a lot of advocating for yourself. No one's going to do it for you. And so finding those graduate student placements that I knew would set me up for success was really important to me, and it was a challenge. So for an example, most speech pathologists and most of the jobs are in the schools. I knew that I didn't want to work in the schools, at least right now. So my biggest challenge was finding this job in acute care. So I reached out, interviewed, took a test, and got the student placement at UC Medical Center. And then when I was a student there, I took the initiative to always show up early, ask to stay late, ask for opportunities, show how passionate I was about it. And then I ended up getting a job there. So it definitely was challenging to get this job, but it was worth it. Yeah, I think that answered the question.
Good. Yeah. I mean, I think a message there is, face your fears, like, whatever, if you're nervous about something or think if something makes you nervous, you gotta, if you want to be successful in the field, you gotta just face it and practice. And
Yeah. Something else that I did was I took whenever I was applying to scholarships or to graduate school, I would take my essays into the Writing Development Center. Your university probably has something like it. And I would have them critique my essays. And that's something that I felt was really worth my time.
That's a great tip. No more questions in the chat. Does anyone else have a question they'd like to ask Lexi?
I have a question. So I go to Longwood and I'm an undergraduate for speech pathology. And I was just wondering what kind of things in the graduate, when you applied to graduate school, do you think helped you stick out? Like, did you get in the first time you applied?
I did, yeah. Yep.
So what kind of things do you think stuck out to the graduate schools?
This is a weird question because I feel like now I'm just like tooting my own horn. But try and get leadership roles. So if you're in an ALD, as you are, try and see if you can get a spot on the board. If you're a member of NISLA, see if you can get a spot on the board and do something that hasn't been done before. So I remember what I really did with ALD was I revamped the way that we recruit and created a whole new ceremony and things like that. Just something to really make your experience unique. So having things on your resume that aren't just speech related, I think are really important. So I think you're already on the right track by having ALD. And I don't know, I only am talking from my experience, but I remember for our undergraduate advisor, do you guys have just like one person for your program that helps you apply to grad school?
Yeah, I think we have two.
Okay. They very much were like, you have to have at least a GPA of 3.4 to get in, at least, is what they were telling us. And they were very much like, you might not get in if you just have a good GPA and nothing else on your resume. And that's true. So it's not, even though you do have to be academically successful, it's not just all about that GPA. So anything that you can do outside of the speech world to build that resume would be awesome.
Okay, cool. Thank you.
Mm-hmm.
And I just want to reiterate, I think a great message that you talked about, Lexi, is it isn't just the position on the board, but something you could articulate that you did. I revamped, I reorganized, I brought something new. I wasn't just a line on a resume. I was the president, even, and the vice president or whatever of my chapter, but talk about something you actually did to make improvement.
Yeah, and I know that I have a lot of friends who are like, I could never be a leadership position. I don't like that. I don't like to talk. I'm an introvert. That's okay. That you don't have to be on the board if you don't want to. Get involved in research, get involved in something more one-on-one, get involved in a mentorship program where you can be a big brother or a big sister, where you're only talking with somebody one-on-one, but just do something that you feel passionate about. And it doesn't have to be that you were the president of X, Y, and Z sorority or whatever. That you can find things that will help you stand out.
Perfect. Great. Any other questions?
I think I just saw one come in.
Yep.
I mentioned I wanted to be a doctor when I was younger, but I wasn't sure about the hours. How did I come across going into speech pathology? Good question. So when I grew up, I was a figure skater. So one thing that I did growing up was I volunteered in an organization where I helped kids with disabilities learn how to ice skate. I learned from their parents and from them that a lot of them were going through PT, OT, speech, and getting those services. And the more that I just learned about it, I thought maybe I should go. And I actually shadowed a PT in high school, hated it. And then I PT'd a speech therapist, or I shadowed a speech therapist in a school, and I thought it was great. So that was how I kind of learned about being a speech therapist. Another thing, if you are somebody who's considering being a doctor or going the med school route, that's great. That's wonderful. We need more doctors. But another career that I would have considered and maybe would in the future is being a PA. Physician's assistant programs, they are very competitive, but they are highly sought after. So that would be another avenue for you guys to pursue if you were interested.
Okay, so let's see, what kind of reactions do we have available to us? Let's give Lexi a round of applause or a thumbs up. But thank you so much. There we go. Thank you, everybody.
Sure. And Trish, feel free to share my email if anybody has questions or wants to talk further about speech therapy. It's cool to see that it seems like a lot of people here are pursuing that field. So I'm happy to help and answer more personalized questions.
That's really nice of you. Thank you for that offer. Thank you so much for your time. Thank you for your involvement with Alpha Lambda Delta back in the day in Cincinnati. But thank you so much for spending your time with us, and thanks all the students for joining. And tell your friends, we'll post a recording of it sometime in the future.
Thanks. All right. Thank you, guys.
Bye-bye. Thank you,
Thank you.
everybody. Bye-bye.